So this video is the testimonial, and before Edgar gonna share his experience to the audience, I'm gonna remind the audience what he used to look like. So, and then you can see that was Edgar before, and again it completely transformed his look. And we lowered his hairline, the front's around an inch, and both sides almost 2 inch, an inch and a half. But look at how young and handsome he look. Frontal view, right hand side. You see excellent density. You can spike up your hair. Left hand side, top view. And that was him. And now I'm gonna leave the stage to Edgar, and he's gonna share experience how hair loss affected him, how he did research, and how he found my clinic, and explain on the surgery day what it looked like in recovery. Go ahead, start from the beginning, Edgar.
Hi everyone, my name is Edgar. I wanted to, before getting my surgery, I just didn't feel comfortable and confident just, being out in public. I used to wear hats a lot just because I had a receding hairline. I started doing research and started learning about the different types of surgery. I decided to go with the FUE procedure because I didn't want to have a scar on my back. As you can tell, I have my hair very short. I like it like that, so I just didn't want to have a noticeable scar. After doing research and just seeing a lot of the testimonials online, I felt comfortable, reaching out to the doctor and just scheduling an appointment to see what my options were.
So you saw my YouTube video?
I did, yeah.
My review online too.
I did. I saw the photos before and after, the videos. I think that really helped just to make me feel comfortable, just hearing from someone that has gone through the procedure.
So now you're on the other side.
Now I'm on the other side, yeah.
That's good.
Yeah.
Okay.
During the procedure, you actually don't feel anything because you're under a lot of different types of medication, so you don't feel any of the pain. I don't remember much throughout the day.
At least your lunch?
I had my lunch. I remember they gave us lunch, so they woke me up for that, and that was good. And then after that, just 2 weeks. That's your rest period. So just making sure that you follow the instructions that they give you. They're very thorough with the instructions that they send you home with. And then I didn't start noticing like real results until maybe 6 months afterwards. And just from there on, it's a big confidence boost. Just people telling you that you look younger and that you don't have a receding hairline, so that's definitely a plus. And I just feel way better now. So
and the important stuff for Edgar is look natural, and
exactly.
He's afraid that you've seen hairline online where it looks so abnormal. Because not every surgeon is an artist, right?
Correct.
And you want to make sure you see a lot of example of the before and after. Right?
Exactly, yeah.
And so then that way you don't walk around with a weird looking hairline.
Exactly.
And look at Edgar right now. He's young and handsome.
Yeah, you can't tell really. It's great.
And with the excellent density, you can spike up your hair. You can gel and do anything that you want.
Yeah.
And not only that, but manual FUE is important, right? Because other clinic and all stuff, the surgeon doesn't pull the hair graft, so they're a lot cheaper.
Yeah.
But then in life, you get what you pay for, right?
That's very true.
Yeah. And the other important factor for Edgar is the donor scar. And as you can see, I film and show the audience that, in the back of the head, we completely shave, right?
Yeah.
And can you turn around so the audience can see? Look at that.
So it was from over here, but you can't.
Yeah. And it's so turn all the way. And that's a great thing about and a lot of people online, they say, oh, Dr. Diep used 0.9 and 1.0 too big right after surgery, and they complain. I say, look, don't complain about this stuff. Complain a year later when you see the result of it. And you see Edgar walking around with hardly any scar and look excellent. But if you don't want to use the tip like 0.6, 0.7, 0.8, when it's so small and it destroys all the graft, then you have no result.
Yeah.
Right, Edgar? You pay to get the result for the hair with density.
For sure, yeah.
And number two is secondary for the back. But what I'm trying to tell you is the 0.9, 1.0, it might be bigger than the 0.7, 0.8.
Mm-hmm.
But the difference is so minuscule you can't tell the difference.
Exactly.
However, it make a difference in terms of how healthy the root is.
Yeah.
At 1.0 and 0.9 has a lot healthier roots than a 0.7 or 0.8. And if you use a small tip, you destroy all the root. It won't grow out.
Yeah, that's true.
And even though they're different, but the size is so minuscule, because if you ever take a ruler and you measure at 0.7 or 0.8 versus 0.9, 1%, you can't tell.
Yeah.
And so the scar, it doesn't change much.
Yeah.
But it makes a huge difference in terms of the result.
Sure does.
And my patient pay to have excellent density result. And with every clinic, with every surgery, I personally involved with the surgery, and I'm the one who designed the hairline, because you need both an artist and a surgeon, and I'm the one who manually harvests the hair graft one at a time. While other clinic, you talk to a salesman, consultant, and then on surgery, or sometimes you talk to a doctor, but on surgery, there's someone else operating on you. Or some clinic 100% operated by technician. So, but again, with my surgery, even though I'm manually harvest the hair graft and design the hairline, but I cannot do the whole surgery by myself.
That's true.
Right? You need a whole team of nurses to work.
That's
and
true.
all the nurses, are personally trained by me. And I thank you, Edgar, to share his experience to the viewer and the audience, so then they will get a glimpse and understanding, it's real, and it's not fake, and Edgar not wearing any topic.
This is real.
And he watched a lot of video now that he's on the other side, and he wants to show the full face to help other guys as well. Just say hair transplant can be natural and can be dense, and it can be done right, but you have to do your research. You never base on location just to make it convenient, right?
No. I travel not too far, but I did travel a little bit.
2 hours from me.
It's a 2-hour drive.
2 hour drive for me, but other people like fly a different country and stay too. So you don't go to a doctor just for convenience, just location. Number one, you want to go to a doctor who will have the best result. Number two, you don't want to base on price. That's where you get yourself in trouble. Because if you go cheap and it doesn't work, guess what? It's gonna cost you more in the long run to pay me to fix it. So do it right at the beginning, and this is only one surgery, and it's a 1.5 year follow-up. Thank you.